You know, Russ, a successful surgical procedure is really just the beginning of the story for our patients, not the end of it. The work we do in the operating room sets the foundation, but the long-term success, especially with something like a dental implant, is truly a partnership that continues for years afterward.
That's such an important point, Brandon. It's a lot like owning a high-performance car. The engineering and craftsmanship might be brilliant, but it still requires proper care and regular maintenance to perform optimally for its entire lifespan. The same is absolutely true for dental implants.
And that long-term care is precisely what we want to talk about today. Welcome everyone to Oral Surgery Insights. I'm Dr. Brandon Rehrer, and I'm here with Dr. Russ Lieblick. Our topic is a crucial one: how patients can properly care for their dental implants to ensure they last a lifetime.
There are some common misconceptions out there, and our goal is to provide a clear, practical guide to maintenance. It's about empowering patients with the knowledge they need to protect their investment in their health and their smile, and the good news is, it's very straightforward.
Let's start by addressing the most common myth we encounter. Some people believe that because a dental implant is made of titanium, and the crown on top is typically porcelain, that it's an artificial tooth that is completely maintenance-free.
That's a very dangerous misconception. It's true that the implant and the crown themselves cannot get a cavity like a natural tooth can. But what's critically important to remember is that the implant lives within a mechanical and biological environment of living gum tissue and jawbone.
And the long-term health and success of the implant depends entirely on the health of that surrounding gum and bone. Those living tissues are absolutely susceptible to disease caused by plaque and bacteria, just like the tissues around natural teeth. Additionally, the forces we put on teeth at night when we're asleep destroy them, and they can hurt an implant.
So the whole goal of dental implant maintenance is to keep that foundation, the gum and bone, healthy. It's all about preventing the massive nighttime forces as well as the buildup of plaque, which is a sticky film of bacteria, around the area where the implant crown meets the gum line.
When we sleep, we put 5 to 7 times the force on our teeth. An implant can experience even more force because it doesn't have a shock absorber. This is the #1 killer of implants.
The good news is that the solution is easy, straightforward, and beneficial to all of our teeth. We recommend that every implant patient wears a nightguard. It can protect your teeth and implants from these forces.
When plaque and bacteria are allowed to accumulate around an implant, it can lead to inflammation of the gums. This is also a threat to the long-term health of an implant.
It's helpful to think of it in 2 stages, much like gum disease around natural teeth. The first stage is called peri-implant mucositis.
Peri-mucositis is essentially gingivitis for an implant. It's an inflammation of the soft gum tissue around the implant, often causing redness, swelling, and some bleeding when brushing. The good news is, at this stage, the condition is completely reversible with improved oral hygiene and professional cleaning.
However, if that inflammation is not addressed, it can progress to the more serious stage, which is called peri-implantitis.
Peri-implantitis is much more like periodontitis, or advanced gum disease. The inflammation has spread from the gum tissue down to the underlying jawbone, and it begins to cause irreversible bone loss around the implant. As the bone that supports the implant is lost, the implant can become loose and may ultimately fail.
So everything we're about to discuss, both home care and professional maintenance, is aimed at one simple goal: preventing peri-implant disease from ever starting by keeping the area clean and healthy.
This brings us to the most important part of the equation, which is the patient's daily home care routine. This is the foundation of long-term success.
It is, and it starts with the basics: brushing. We recommend brushing at least twice a day with a soft bristled toothbrush, either manual or electric. It's especially important to angle the bristles toward the area where the implant crown emerges from the gum line and clean that junction thoroughly.
But brushing alone is not enough, because a toothbrush cannot effectively clean the spaces between the teeth or implants. Cleaning these inner dental areas daily is absolutely critical.
This is where we often need to introduce some specialized tools. Traditional dental floss is still a great option for many single implants. It's important to learn the technique of wrapping the floss in a C shape around the implant crown and gently cleaning below the gum line.
For many patients, a water flosser, like a water pick, is an incredibly effective tool. It uses a pulsating stream of water to flush out plaque and food debris from around and between implants. It's particularly useful for patients who have difficulty with traditional floss or for cleaning around more complex restorations like implant-supported bridges.
Another excellent option, especially if there are slightly larger spaces around the implant crowns, are small brushes called interdental brushes or proxy brushes. They look like tiny pipe cleaners and are very effective at cleaning the sides of the implant and the gum tissue.
The key isn't about finding one single magic tool. It's about working with your dentist or hygienist to find the combination of tools, be it floss, a water flosser, interdental brushes, or something else, that works best for your specific restoration and allows you to effectively clean all surfaces every single day.
That consistent daily commitment to cleaning is what prevents the harmful bacteria from gaining a foothold and starting that inflammatory process.
Now, diligent home care is essential, but it must be paired with regular professional maintenance. It is not possible for a patient to remove all of the hardened plaque or tartar that can form on their own.
This is where the patient's general dentist and dental hygienist play a vital ongoing role in their long-term implant health. We recommend that patients with dental implants maintain a schedule of regular professional cleanings, just as they would for their natural teeth. The frequency might be every 3, 4, or 6 months, depending on their individual needs.
During these appointments, the dental hygienist will use specialized instruments to clean around the implant restorations. It's important that they use instruments made of materials like plastic, graphite, or titanium, rather than traditional stainless steel scalers, which could potentially scratch the surface of the implant components.
They will also perform a thorough examination of the implant and the surrounding tissues. This includes checking the health of the gum tissue, gently probing to measure any pocket depths around the implant, as deepening pockets can be an early sign of trouble, and checking to ensure the crown and implant are tight and stable.
And periodically, typically on an annual basis, they will take a specific X-ray of the implant. This allows us to look directly at the level of the bone supporting the implant. A stable bone level on X-rays over time is the key indicator of long-term implant health and success. If we see any signs of bone loss, we can intervene early.
The specific maintenance routine can also vary slightly depending on the type of restoration the implant is supporting.
That's a good point. For a single implant crown, the home care routine is very similar to that of a natural tooth. But for a full arch fixed bridge, often called an all-on-4 or a hybrid prosthesis, the hygiene requirements are different.
With these full arch restorations, there is a small space between the bottom of the bridge and the gum tissue. It is absolutely crucial for the patient to be able to effectively clean this space every day to keep the underlying implants and gums healthy.
This is where tools like water flossers and specialized floss, like floss threaders or thick super floss, are not just helpful, they are essential. The patient needs to be able to flush out and remove any food particles or plaque that can accumulate under the bridge.
We, and their restorative dentist, spend a significant amount of time with patients who receive these restorations, providing hands-on instruction to ensure they are comfortable and proficient with these specific hygiene techniques. It's a key part of their long-term success.
And while the routine, day-to-day maintenance is managed in partnership with the patient and their general dentist, we, as the oral surgeons, remain a part of their long-term care team.
We typically see patients for a follow-up visit about a year after their surgery to ensure everything has healed and integrated perfectly. After that, if their general dentist ever notices a concern during a routine checkup, perhaps a deepening pocket or a change on an X-ray, they will refer the patient back to us for a specialist evaluation and management if needed.
So Russ, the idea that dental implants are a fit-and-forget solution is a significant myth. They are a highly successful and durable long-term solution. But that success is dependent on a partnership.
It absolutely is. It's a partnership between the patient, their general dentist and hygienist, and the oral surgeon. When the patient commits to consistent daily home care and they attend their regular professional maintenance appointments, they are actively ensuring the health of their investment.
The principles are simple. Keep them clean every day, wear a nightguard, and have them checked professionally on a regular basis. That combination of care is what prevents the complications of peri-implant disease and allows these remarkable restorations to function beautifully for many, many years.
It's a lifetime commitment to care for a solution that can truly last a lifetime. We hope this discussion has provided a clear and practical guide to dental implant maintenance and has empowered our listeners with the knowledge to protect their smiles. Thank you for making Oral Surgery Insights a part of your day.
We appreciate you listening, and we trust this conversation has been both helpful and informative.
We wish you the very best in your health.